Charle Brennan, the voice of St. Louis. Dr. Mary Noel George is kind enough to share some time with us today. She's a dermatologist at Dermatology STL. Good morning, doctor. How are you?
Good morning. Very well, thank you.
So people look at these skies and they figure, don't need SPF today.
That's wrong. So unfortunately, even on cloudy days, you need to wear your sunscreen. So I tell my patients, even if it's snowing in February, still have to put on your sunscreen. Up to 80% of the ultraviolet rays from the sun come right through clouds, car windows. Still important every day.
So even on a day like today, look outside, it's gray, it's rainy, one should be applying SPF.
This is true. 365 days a year, it's important to put it on.
That is really interesting. Okay, surprises me. Let me take a look at indoor tanning beds. We still have them in the state of Missouri. In fact, probably throughout the country, right?
Yep.
If I put on SPF, can I still go to one of these, or does it even make any sense to do that?
Not smart. Very not good to do that. Indoor tanning, the people who frequent those indoor tanning places have a very high risk of ultraviolet exposure to their skin, and we know that is one of the most the leading cause of skin cancer, particularly melanoma in the United States. And unfortunately, the rates of melanoma are increasing every year, particularly in our younger women, the 15 to 30-year-old women, and we think it's due to the using indoor tanning spots.
So you're actually seeing in your practice melanoma among 15, 16, 17-year-olds?
Yes, and increasingly so. It's one of the few cancers that's on the rise.
And how prevalent is skin cancer?
1 in 5 Americans will be diagnosed with skin cancer at some point in their lives.
But the SPF can actually reduce that incidence by almost 50%.
This is true. Wearing sunscreen every day dramatically reduces your risk of skin cancer.
How much sunscreen must one apply?
1 ounce to cover all of the exposed areas of the body, areas not covered by clothing. And 1 ounce we say is a shot glass full. So it's a lot. If you think of most sunscreen bottles that you buy are 4 to 6 ounces, you should be going through that in 4 to 6 applications.
That's pretty expensive, isn't it?
It does. It does get pricey. On your typical day like today, if you're working inside, not going out, it's cloudy out, your exposed areas are small: face, neck, ears, hands. But if you're really going to be outside, those, and the temperatures increase and you're wearing short sleeves and shorts, it's putting on a lot.
Mm-hmm. Now, can you recommend some sunscreens for our listening audience that actually do the trick?
I do have several favorites. Some brands that I like to use in particular are Elta MD. That one is retailed through doctors and doctors' offices, so that one you can't find over the counter, but it is great. You can find it on their website. Other ones that are over the counter, Olay Complete Defense SPF 30 is particularly good. For the really active people that are outside, running, cycling, biking, working outside, gardening, Blue Lizard Sport and Vanacream Sport are great ones. They really stick on your skin. They're very water resistant, which means they can stay on up to 80 minutes of heavy swimming and sweating and such. But no matter what you choose, what brand you choose, it's just important to look for the SPF number being a minimum of 30. And particularly looking for ingredients that contain zinc or titanium.
How much zinc or titanium?
I like to see numbers of 5% or higher. A lot of the products that I just mentioned that are my particular favorites have 9 to 10% zinc.
But does that leave like a white pasty look?
It can. So that's what you think of, in the not so fashionable old days when people would have the white zinc on their nose with the lifeguards on the beach. That is zinc. It's the best physical blocker of ultraviolet light. The higher price, the more expensive sunscreens that you'll find have micronized the zinc, so it's smaller particles, so it doesn't go on white. So a lot of the times when you're paying for more expensive brands, you're paying for ones that are more cosmetically elegant.
Also people like to use a moisturizer in the morning. Are there any moisturizers that also have SPF in them that might do the trick?
Yes, there are several. So the Elta MD line that I was referring to, almost everything in their line is a facial moisturizer that has sunscreen in it. So that's wonderful. The Olay Complete Defense also daily facial moisturizer with sunscreen in it. And several of the Neutrogena brands too are moisturizers with sunscreen.
My daughter recently saw a flyer asking for lifeguards for a local city, Richmond Heights. And in the brochure, the little flyer that was posted, hey, we're recruiting lifeguards, it said, get a great summer tan. Is there a safe tan?
No, there is no safe tan. Ads like that are alarming and disturbing to us who know better. There is no safe tan. So the tan, getting a tan is your skin's way of saying that it's being damaged by the light. So it's trying to protect itself. And even if you aren't someone who gets sunburned, tanning over time slowly changes your skin, making you, wrinkled, looking age, sunspots with no sunlights. But even more important than that, dramatically increases your risk of skin cancer, particularly basal cell and squamous cell carcinomas over time.
And if you, throughout your youth, get 5 blistering sunburns, what happens?
You have an 80% increased risk of developing melanoma.
Well, I definitely fall in that category. Back in the day, sunburns were kind of just a rite of spring.
Yeah. Unfortunately.
Oh, I'm sorry about
that. Hopefully we know better. And now it's becoming a lot easier to protect our skin. A lot of the there's clothing now with sunscreen in it, which makes it a lot easier to protect ourselves and protect our children too. I just saw a really cute, we call them surfers call them rash guards, but clothing with SPF in it, long sleeve things that can protect their skin. And Nordstrom had one that said pale is the new tan. So cute ones for kids that are out. And it's a lot easier to put those long sleeve clothing items on your children than chasing around the pool trying to schlep on more layers of sunscreen.
So you do swim. You're a former D1 swimmer at Davidson, as I understand it. And when you swim in the summer, you wear long sleeves.
I'm the one out there with the rash guard fully covered up and heavy zinc oxide on my face, my neck, my ears, my legs. So...
All right, folks, it's 436-7900. We're going to take your phone calls. Dr. Mary Noel George, local dermatologist. In fact, she's with Dermatology STL. Is that also the website, dermatologystl.com?
Yes, that's right.
All right. Our phone numbers right now are 436-7900, 800-925-1120. Talk about the sun and your skin, and Dr. Mary Noel George is with us. She joins us once or twice a year to share some advice on protecting yourself against skin cancer. Did you say about 9,000 cases a year? 9,000
cases a year, yeah. And with melanoma, a person dies every hour from melanoma. Quite frightening.
Yes. Okay, so at 436-7900, 800-925-1120, we are taking your phone calls today. Again, real quick, in and out at 314-436-7900, 800-925-1120. Robert, you're on KMOX. Good morning, Robert.
As a child, I spent every day outside, no shirt on, but in the neighborhood did. Pools or no pools. And sure. I got blisters on the back of my neck, on my shoulders especially, and they put something on there, pop those blisters. People who had that, like I did, are they more vulnerable to getting skin cancer today than the person who didn't have that?
Yes, much more at risk of developing skin cancer. We know that blistering sunburns of that nature dramatically increase your risk of melanoma, in particular, that form of skin cancer. So you're at a very high risk. But it's all types of sun exposure, both the blistering sunburns and the incidental tans we get every day. So it's really important to have your skin checked by a board-certified dermatologist annually, especially with that history.
436-7900, 800-925-1120. Dr. Mary Noel George is with us. Diane, you're on KMOX.
Hi, Charlie.
Good morning.
Good morning. I'm a patient of Dr. George, and so is my daughter. She's wonderful. But I wanted to ask about I wanted her to address the need for sunscreen with people with darker skin. My daughter has African American friends, and people with darker skin. We're Caucasian, but do they have the same need to wear sunscreen and same risks as lighter skinned people do?
Their risk of developing skin cancer is less because with pigmented skin tones, African Americans, Indians, Hispanics, etc. The darker the skin tone, they have more melanin that's produced in their skin cells, which is a natural protecting it against the ultraviolet rays of the sun. So their risk of skin cancer is dramatically less than Caucasians. And then the fairer you go with Caucasians, the chance of developing skin cancer increases. So the risk is less. However, I do have a handful of patients who are African American and even darker African Americans too who have skin cancer. So it is still important to follow the rules of sun protection and sun safety, even for darker skin tone.
Is the sun more brutal than it used to be?
No, it's the same that it used to be. We think that it's the same. It's not quite. We're not quite sure of that because of the decreasing amount of ozone in our atmosphere, but it's for the most part the same. But we think the incidence of skin cancer is on the rise because of the use of indoor tanning in particular, and people spending time outdoors, not protecting their skin.
Sure. Bob, you're next on KMOX with Dr. Mary Noel George at DermatologySTL.com.
Yes, years and years ago, I had a job as an intern for some dermatologist researchers, and they were working on an oral solution to this, where I think they were going to increase the level of melanin in the skin, and I've never heard anything about it. I just wondered whatever happened to that idea.
So, great question. So there is an oral supplement that is on the market called HelioCare some studies do show that it offers somewhat of a protective benefit when taking it. As far as the risks and side effects of that pill, they're minimal to none, but it might help give a protective element. So it is available, when my patients tell me that they might be going on really sunny vacations to tropical areas, especially, in the dead of winter when their skin isn't used to having much ultraviolet light on it. It is something that I recommend because it's unlikely to do any harm and might just give you a little extra protective benefit.
That is absolutely fascinating. Had no idea about that. Is that over the counter or by prescription?
It's over the counter, but it does not take the place of sunscreen, wearing big hats, trying to stay in the shade.
Yes. You do see some women in some cultures, like Asian ones, who do walk in the summertime with a parasol.
Parasols and big hats. Lighter skin tones are more favorable, considered a higher form of beauty in Asians and in Indian populations as well.
Carol Daniel from KMOX News is on the line right now. Bob, thank you very much for your phone call. Carol, Dr. Mary Noel George, Carol Daniel.
Hi, Carol.
Well, hi, Dr. George. And Charlie, I just wanted to chime in because my younger sister, who lives in Houston, Texas, actually developed skin cancer and has been treated, and she's fine, but she has to go back in every year. And I wear the oil of Olay that you spoke of. I wear that every single day. And I remember when my sons were in daycare and I would put sunscreen on them and I'd get kind of sideways glances from people. I knew they were wondering, you're black, do you not, you don't have to worry about skin cancer. And I worry about the quality of my skin, and I do worry about skin cancer. So I make sure my husband has it, sunscreen, he's a landscaper, and so I'm African American, and I think that everybody should worry about the quality of their skin. It doesn't matter what your ethnicity is.
Thank you so much for bringing that to everyone's attention because it's a problem for everyone, no matter what your skin color, and everyone should be practicing safe sun habits. So thank you so much.
Carol, thanks for the phone call today.
Not to mention wrinkles.
Yes, sun is the number one cause of aging and wrinkles, which no one wants.
Carol, thank you very much. John, you're next on KMOX.
Yes, hello. Yeah, Richie George is a buddy of mine. But anyway, I had melanoma spots about 3 years ago, and they removed them. The dermatologist is a great guy, but what's the probabilities of those coming back?
If your skin cancer is treated adequately and caught early, the cure rate for most skin cancers, including really early forms of melanoma, is as close to 100% as you can get. So low risk of those recurring. However, it does mean that you are at a much higher risk of developing other skin cancer in the future. We know that if you have the more common forms of skin cancer, like a basal cell skin cancer or a squamous cell skin cancer diagnosed, your risk of developing a second is over 50% in the following 3 years. So I follow my skin cancer patients once they've had one diagnosed every 3 months, sometimes even sooner for the first year or two, and then we try to spread out the visits if we can. But close surveillance by both the patient yourself, looking over your skin once a month month to do self-skin checks, look at your moles. Is anything changing? Is anything new? Crusting, scabbing, bleeding? And then really close follow-up by your dermatologist is very important.
Okay, thank you very much for your call, John. Our guest is Dr. Mary Noel George from Dermatology STL. Hi, Sharon.
Hi, how are you?
Great.
Question for the doctor, please. When going on vacations to sunny destinations, actually this happened twice this year, Florida and Hawaii, I try to take precaution, wear a brimmed hat, and put over-the-counter SPF lip protection on my lips. But it ends up being, and I think I'm reapplying it frequently enough, my lower lip tends to swell and I get blisters on the inside, and it's happened to other people I've traveled with. So I wonder if doctor has a good recommendation to avoid something like that.
Using lip balm with sunscreen in it. The Elta MD brand that I recommended has a really high amount of zinc oxide in their lip protectant. Vanacream is another brand that has a great lip protectant with a high amount of SPF and zinc in it as well. You're doing the right things by wearing wide-brimmed hats. The sores that you're getting in your mouth, it could be several different things, so they would need to be evaluated when they were active. But, people often forget about the lips. And I see a lot of precancers and unfortunately skin cancers on the lip. But one of the more common forms on the lip is a squamous cell skin cancer. And that one, because its proximity to blood vessels and nerves in the area, can track down the nerve and become fatal. So, we often neglect our lips, but it's a really important area that still needs sun protection on it.
And what's this? What does that look like on the lip when you have that problem?
A crusting, scaling area that just does not go away.
Sharon, thank you very much for joining us. By the way, that ELTA that you recommend is ELTA.
Correct.
I've been spelling it ALTA, but it's ELTA.
ELTA, yes.
All right, thank you. Lots of calls. Let's all be brief and to the point. Matt, we're talking about skin. What do you have to say?
I know at one time there was a local hospital here that was offering a free annual skin cancer screening fair where you could just show up and get checked by a doctor. Do you know if anybody is still doing that?
Yes, thank you very much for asking that question. May is Skin Cancer Awareness Month, and May 1st is Melanoma Monday. So because to support the efforts of skin cancer awareness and sun protection, the American Academy of Dermatology hosts free skin cancer screenings in almost every major city and small towns across the country during the month of May. And there are several facilities staffed by board-certified dermatologists during the month of May that offer free skin cancer checks. And as you know, for the population, you can come in and just have a spot checked, or if you want, you can get into a gown and have all of your skin checked. But these are free and offered and staffed by board-certified dermatologists. So if you go to the AAD, which is the American Academy of Dermatology, aad.org website, it should pull up a list of facilities, hospitals, clinics around the area that are having the events.
For some reason, the melanoma rates have doubled since 1980. And I got to believe in 1980 we had sun lamps, so the sun tanning booths are not new. What do you account for that?
I really do think it's increased indoor tanning behaviors amongst our young people, especially young women.
People used to buy sun lamps.
Yes, and have them in their basement and use them frequently. Yeah. Yes.
Yeah. Okay, Matt, thanks for your call. Let's go to Mike. Mike, you're on KMOX.
Hi, I have a quick question for you. I have eczema in certain situations when it'll break out in a spot or two, but recently, well, more than recently, for a while, I have hands that itch dramatically, can just come on, and I'll start scratching, and it'll eventually stop. Right now I'm looking at my right thumb from previous episodes. It's all crusty on top and cracked. And it's my hands that I don't understand why.
Have you seen a doctor yet, Mike?
Oh, I have the dermatologist that I have seen. I haven't. I do to go, but since she was on, I was just wanting to get an opinion.
Yeah, so it would be really important to consult a dermatologist about that issue because there are several different things that could cause that. Irritating products on the skin that could be an allergic contact dermatitis with something your skin is getting exposed to that it's allergic to. And there's just also innate forms of dermatitis that affect the hands.
And you'd be surprised what people are allergic to. I knew somebody who played an instrument, I think it was a flute, and turned out it had nickel or zinc in it, and she was allergic to it and caused like little some sort of dermatitis on the hands.
Yeah, nickel is one of the most common allergens, contact allergens in America every year.
No
Belt
kidding.
buckles, snaps in the skin, costume jewelry, earrings.
We have just less than 30 seconds to go. How about the ABCDs of melanoma? A little information for our listeners before we let you go.
Yeah, so what you should be paying attention to with your moles and whether or not they really deserve attention is the ABCDEs of melanoma. What are markers? A stands for asymmetry, something that's not uniform on both sides. B is border, so if the borders are jagged or irregular. C is color, a mole with lots of different colors, brown, blue, black, red within it. D is diameter, anything over 6 millimeters, which is the size of a pencil eraser. And E is evolving. Any new mole or anything changing really should be looked at by a dermatologist.
Dermatology STL, that's dermatologystl.com for Dr. Mary Noel George, who was kind enough to take some of her Friday away from whatever you ordinarily do on Friday to join us today on KMOX.
Thank you very much for having me on.
Thank you so much. Hey.